Hi friends, morning. How you all doing? Yes. Hi, evening. A thumbs up or a hi message. Make some noise in the group, the YouTube chat. For people. For friends, what's happening? Hey, Amit Dadlani is available. Yes. What's happening to other friends? Hi friends. How's the paper? You all give the paper. The paper. Hi Divya. Yaksh. How's the paper? The paper. Good. Easy, very easy, difficult, average. Everybody who's available here, give a thumbs up. Hi, like Kachar. Hi, Dr. Sudhagar. This was very easy. Very good. Sandhu. Wow. Good. It's very easy then. So tell me, have you read psychiatry before? Okay. What I have done in this TNT is that, as you would have seen the paper, I've deliberately added the questions in the chapter wise. First four chapters, first four questions will be from phenomenology, next three from delusional disorders. So that our discussion would not be going half as that way, so that it will go in a more organized manner. Because anything which you read organized, you'll be able to recollect, and you'll be able to register it very in a better way. And second thing, I have included a lot of PYQs, previous year questions and previous year topics, so that so that you should know that these are the topics which you should be giving your attention. Okay. So what we are going to do is, we are going to, if you have attended to my one of my any of my previous sessions, you should have known by this time that I'm a person who always expects a lot of interaction in the Telegram group and the youth chat group, so that it's not a one-way communication. It's going to be a two-way communication. Yes, it's a small brief introduction. So with this small brief introduction, I think we are good to go. We can start. Yes. Thank you, Utkash Santuja. The first question that we are going to deal is, this is the first question. I'll just read out the question. A person at the night looks at the window and frightens. Wife switches the light on and turns out that the window cover is having a shape like a man. This is called as. This is called as. What is this called as? What is this called as? Very simple. What is this called as? Illusion. Wonderful. Wonderful, Amit Dalni. Yes. What do you mean by illusion? Can you tell me what do you mean by illusion? What is the definition of illusion? What do you mean by illusion? Anybody? Sai Gaurav saying it as a definition for hallucination. I'm asking about illusion. What is illusion? Misinterpretation. Misinterpretation of a stimulus. It's very good. I give it to Neha Sa. Yes. So illusion is nothing but misinterpretation of a stimulus. You need not take any notes. Okay, if you are already listened to it, please give your 100% here, because this I think will be shared to you. So illusion is nothing but misinterpretation of a stimulus. Yes. Next we have something called as. It's very famously what we call it as is a person in the middle of the night. Okay, that as given in the example, a person in the middle of the night identifies a rope as a snake. There is a rope, but I am identifying it as a snake. What is it called as? The middle of the night, I go from my bedroom to the hall. Suddenly, I see a ghost. Okay. Okay. When I switch on the light, then only I realize, okay, it's not the ghost. It is my wife. Okay. So there is a stimulus, but I am perceiving it wrongly. That is called as misinterpretation of a stimulus. Misinterpretation of a stimulus is called as what? Yes. Yes. It's very simple. Very simple. Famously asked questions will be: a person in the middle of the night identifies a rope as a snake. There is a stimulus, but I am identifying it wrongly. There is a screen, but I am identifying it as a ghost. Yes, friends, is it called as illusion? Next, we have something called as. Hallucination. Yes. What is hallucination? What is hallucination? Yes, friends, what is hallucination? Very good, very good, very good. Very good, Jayashri. Very good. What is hallucination? Answer. Let it be a two-way communication so that it's how we learn. What is hallucination? Hallucination is nothing but, as one of our friend has told, yeah, like Sai Gaurav has told it, perception without a stimulus. Perception without a stimulus. Wonderful. Wonderful. Now, this hallucinations can be of multiple types. Okay, this hallucination based on the sensory modality, it can be of multiple types. Yes. What are the various sensory modalities that you have? Yes. Now, what is the common cause of auditory hallucinations? Yes. I have a channel in Instagram, okay, in which I usually put questions on PYQs, okay, previous year questions. And today morning, I had a question on this topic. Okay, what is the most common cause for auditory hallucination or visual hallucination? Very famous, previously asked question. Let me see who's going to answer this. Yeah, I think one of our friend Abhishek, he answered nearly, has got nearly 98 questions correct. It seems he answered it very promptly. So, what is the most common? Yes, wonderful, wonderful, Yaksh. So, the most common cause for auditory hallucination is schizophrenia. I would recommend you to also note it down that functional cause or psychiatric cause also presents with auditory hallucination. Functional cause and psychiatric cause also functional or psychiatric cause. Okay, usually when a person comes to a OPD emergency with auditory hallucinations, the specialist that you will call for is psychiatrist. Usually a person with psychiatric condition will come and complain that he's having auditory hallucinations. Yes, yes, Sai Gaurav, you are clear? Yes, yes. Now, what is the cause for visual hallucination? Visual hallucinations is exact opposite. Organic cause or neurological cause. Yeah. And when it comes to psychiatry, yeah, among psychiatric conditions, where do you see this visual hallucinations is delirium. I'm going to ask you a question. Which substance withdrawal do you see delirium tremens? That's a very, 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 very favorite one-liner. It's wonderful, wonderful. Divyaksh. Yes, good. Delirium tremens is seen in. So who is going to answer this? Delirium tremens is seen in. Very good, very good. Dr. Sudhakar has already answered it. It is seen in alcohol with alcohol with. Yes, yes. This seems to be very simple. Yes, yes. Next, next. Uh, next is nothing but what do you know about tactile hallucinations? Yeah, when a person comes and says that, sir, I'm perceiving that insects are crawling on my skin. What is this called as? What is it called as? Anybody? Tactile hallucinations also called as cocaine bugs, also called as formigation, also called as magnetism. Yes, I've asked this even in the question. It's very, 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 very important because the word formigation is in psychiatry books for the past 100 years. But they have asked this term, okay, formigation. They have asked in the exam in the INICT May 2000. Yes, wonderful, wonderful. I'm happy that Divyaksha has answered it. Yeah, yeah, very good, very good, very good, very good, Jayashri. Good going. Yes. Yeah. Now this I wanted to concentrate because this is a recent question that has been asked in the INICT. Yes, yes. Why I want you to just concentrate on the recent type questions is because you should know, because formigation is also called as cocaine bugs or also called as Magnan syndrome, also called as tactile hallucination, is very basic in psychiatry. If they ask it in an INICT exam, it's considered to be the very standard exam in the whole India, then it means that examiners expect students to know about basics. Yes, yes, yes. Very good, very good. Next we have something called as next we have something called as a person comes and says that he's having a smell of a burning tire or a smell of a burning tire cadaver, which is something but olfactory hallucinations. Sir, I didn't put anything in my mouth, sir, but I'm getting some taste, sir. Some bitter taste I'm getting, sir. I didn't put anything in the mouth. Why am I getting the taste, sir? What is that? What is it called as? It's nothing but olfactory hallucinations and gustatory hallucinations, which is seen in. Let me see who's going to answer this first. Expecting answer from Jayashri. Sudhagar. Olfactory and gustatory hallucinations is seen in. Wonderful. Amit Dadlani. Very good. It's as seen in temporal lobe. Why? Because anatomy guru Dr. Ashmi Ji would have told you that olfactory and gustatory fibers end in the temporal lobe, and any epileptic focus there will present as temporal lobe epilepsy. Yes. Yes, friends, is it clear? Temporal lobe epilepsy. Is it clear? Yes. Is it very clear? Yes, friends. This is very clear. Very good. Now tell me what is called as, what do you mean by delusion? What do you mean? Anybody can tell me what is a delusion? What is delusion? Anybody can tell me what is delusion? Don't expect, sir. These are all I've learned in my first LKG itself, sir. Why are you teaching all this? Because it is often asked in exams. Okay, often asked in exams. Examiner feels that let me ask a difficult question. He always expects, so he will ask the basic questions. Very good. JKN is saying false, fixed, firm belief. Okay. Very good. Ajay Kachar is saying that it's a thought content disorder, false, fixed, firm belief, where a person is very certain. Yes. Subjective certainty. Yes, very good. Very good. Everybody is getting it right. Now, I'll ask a question. How many of you believe in God? How many of you believe in God? Tell me, how many of you believe in God? Very good. Very good. Jayashri and Kishore Singh. Tell me, Jayashri and Kishore Singh, do you all believe in God? Yes. How many of you believe in God? Yes. How many of you believe in God? So RNS Pi is believing in God. Yes. Yes. Sai Gaurav is also a believer in God. Now imagine that RNS Pi and Sai Gaurav and JKN are all believing in God, and I'm a person who says that God doesn't exist. I'm a person who feels that God doesn't exist. Now you're all very having a fixed, firm belief that God exists. Sir, God is the one which is guiding me. God is the one which is going to give me the peace seat. God is the one which is going to give me all luxuries in life. I'm a person who feels that God doesn't exist. I am also fixed and I'm also firm in my thought. You are also fixed and you are also firm in my your thoughts. Now, who is having a delusion? One should be false, right? Who is having a delusion? Who's having a delusion? You or me? Who is having a delusion? You or me? Now, nobody. Very good. Why? Because the definition of delusion is with false fixed firm belief with a subjective certainty outside one's outside one's socio cultural background. Yes, because subject. The main thing is that in our society there are a group of people who believe that God exists. God is everything. Yes, my parents are really like they are totally believer of gods. It is nothing but at religious people. Yes, in our society there are a group of people who say that God doesn't exist. God doesn't exist, sir. God is not present, sir. These are people whom you call it as atheist. Yes, anything which is common in the society, anything which is prevalent in the society, anything which is followed in the society, you don't call it as delusion. Then what do you call it as delusion? What I call it as delusion is I say that Amit Dadlani and this person called as Jayashri, these two people are planning to kill me. Yeah, they have sent people outside my house so that they have sent people so that they are all going to kill me. You're all saying, sir, Pavam sir, this Jayashri and this Amit Dadlani are good fellows. Why are you having such beliefs, sir? When the whole society, when the whole culture, when the whole society is not believing it, but I hold it very strongly. I have a fixed, firm belief, which is actually false. When the whole society or the culture doesn't accept it, but I believe it strongly, then you call it as delusion. Okay. I see two people in my class who are just smiling. Okay, I'm saying that these people are making fun of me. Few people are saying, sir, they are lovers, sir. They are like that only. They'll be keep on giggling in the class, sir. You mind your own business, sir. No, no. I'm saying that no. These people are making fun of me. These people are talking about me. These people are referring and mocking me. And the whole society or the culture doesn't believe, but I believe it strongly. That is called as that is called as yes. Is it clear, Kishore Singh? Yes, yes, yes. Now this delusion is of multiple types. Is of multiple. There is something called as delusion of persecution and reference. Can anybody tell me what does delusion of persecution and reference? Can anybody tell me what is delusion of persecution and reference? Persecution is nothing but people are planning against me. Reference is nothing but people are referring and talking about me. Now this persecution and reference is seen in schizophrenia. Very good, Ajay. Schizophrenia. Yes, yes. Now this is a very important point. What do you mean by delusion of nihilism? Let me see who's going to answer this first. What does he mean by delusion of nihilism? What is delusion? Kishore Singh, you try to answer. What is this delusion of nihilism? What is this delusion of nihilism? Nihilistic delusion. What do you mean by that? What is this nihilistic delusion? What is this nihilistic delusion? Wonderful, wonderful, Divyaksh. That is, the whole world is going to die. Yes, I am going to die. I'm going to die. The whole world is going to die. I don't exist. My gut doesn't exist. My head doesn't exist. Okay. That is nothing but that is seen in what is called as, who will say this? A happy person will say or a sad person will say? Depression with psychosis. Depression with psychosis. Okay. See, this nihilistic delusion was asked in the recent INICT, May 2023. If you have been following my Instagram page, I would have been mentioned this as a previous year question topic. Okay, why I was very much shocked when I saw this question in the exam paper was because this nihilistic delusion word was in psychiatry textbooks for nearly 100 years. Okay, and they are asking this in INICT May 2023. INICT May 2023. It is very basic. Which is very. Yes, friends. Yes, friends. Yes. Yes. Sai Gaurav already answered. Wonderful, Sai Gaurav. Grandiosity means what? I am God. I have extraordinary powers. People are there are trying to get my appointment. People are Ambani wants me to be as a chief guest, as wants me to be a chief guest in his son's marriage. So that is nothing but he will stop the marriage if I'm not coming to his marriage. So basically, what is that? It's nothing but you feel that you are a very superior person, special person, extraordinary powers. So which is seen in an happy person. What is a happy person? Mania with the psycho. The psycho. Yes, 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 friends. Is it clear? Is it clear? Yes, yes, dear friends. Very good. Sourcing and Jayastri. Very good. Now I want you to just, let's just go to the question paper. Okay. Let's see if we are able to answer the questions correctly. Okay. The first question is, person at night looks at the window and frightens. Yes. This is nothing but at very clear. Illusion. Yes, misinterpreting. There is a stimulus, but I am misinterpreting it wrongly. Okay. Other name for tactile hallucinations is, anybody can tell me this? Very just now I told you. This is again a INICT star question because I have chosen it from the previous year exam. What is this called as? Yes. Yes, friends. What is this? Very good, JK. Formic. Husband having a false, fixed, firm belief that his wife is having an affair with another man despite evidence to the contrary. What is the diagnosis? Whenever they have words called as false, fixed, firm belief, is very certain about it, but nobody is believing it, then you call it as, wonderful, wonderful. JKN, you are really smart. Very good. Answer is delusion. Answer is delusion. Yes, friends. Yes, friends. Is it clear? Is it clear? Is it clear, friends? Yes. Yes. Give a thumbs up. Give a thumbs up if you are able to follow. Give a thumbs up if you are able to follow. Yes. Next we have something called as, there is something called as, very good. Thank you, JK. Delusional disorder. What do you mean by delusional disorders? Anybody can tell me? Anybody can tell me what is a delusional disorder? Yes. Anybody can tell me what is a delusional disorder? You should ask me. Okay, please ask me questions. Okay, that's how we learn. Sir, there is a diagnosis called as schizophrenia. Sir, it is also seems to be a psychotic symptom. Now, what is this delusional disorder, sir? Please explain me about this. What is delusional disorders? Anybody can tell me what is delusional disorders? Anybody? What is delusional disorders? Delusional disorder is a disorder where the person will have a predominant, but there is no hallucination. Now that is how you differentiate. Okay, that's how you differentiate between delusional disorders and schizophrenia. Because in your question in schizophrenia, they will also say that the person is having delusion, but associated with it, they'll have hallucinations also. What is the hallucination that you will see in schizophrenia? What is the hallucination? I told you, auditory hallucinations. Are you able to find the difference? Are you able to find the difference? Yes. Yes, friends. Are able to find the difference? So when there is only delusion, there is no hallucination. Other than the delusion, if you talk with the person, seems to be very much normal. Okay, functionally is very normal. Only when you talk about the delusion or the topic of delusion, things are going out of the control. Otherwise, is normal. Functionally is normal. Then you call it as delusional disorder. I have a person. I have a patient who's working in a government. Okay, he claims that his superior is planning against him. He takes all actions against him. But when only when he talks about that content, he will talk things. Okay, of false fixed firm beliefs. But talking about other politics, other things like election, sports, everything, it will be very much clear, crystal clear. So functionally, it will be very much normal. This delusional disorders, this delusional disorders can be of multiple types. Okay, one and the very important thing that you should learn is Othello syndrome. Anybody can tell me what is Othello syndrome? Somebody has answered it as Othello syndrome. This question, it's very nice that you have learned it, but anybody can tell me what is Othello syndrome? Thank you, thank you. Gaurangi Trivedi. What is this? Othello syndrome. What is Othello syndrome? Yes, yes. Wonderful, wonderful, Vignesh. Wonderful, Vignesh. Othello syndrome is nothing but Othello syndrome is nothing but delusion of marital fidelity, also called as delusion of pathological jealousy, also called as delusion of morbid jealousy. Now, this Othello syndrome or delusion of marital fidelity or pathological jealousy or morbid jealousy is common in whom? Common in whom? Alcoholic. Why do alcoholic males have this? Anybody? Anybody can answer this question. Why do? Yes, very good. Amit is right. Why my wife is having an affair? Why do these people have this alcohol? It's common alcoholic. It's very good. Tell me, Kishore Singh, Jayashri, or Gaurangi Trivedi. Tell me, why does alcoholic males have this? What is there in the alcohol which makes a person to have Othello syndrome? Yes. Anybody? Yes. Yes. Wonderful, wonderful, Amit. See, basically, what happens is that when a person takes alcohol too much, what happens? It damages the liver. The liver is the one which causes the sex hormone binding globulin is produced. So again, it is damaged. So it causes a lot of sexual erectile dysfunction, erectile problem. Now what happens is that see, I've been practicing psychiatry for nearly like from 2013. So I can confidently say that from male, the most difficult or painful thing on earth is that he's not able to satisfy his partner. Yeah, I am a person who's having Othello syndrome. I am feeling that I've been taking alcohol, so I'm having erectile dysfunction. I'm very much concerned that I'm not able to satisfy my partner. Now, what happens is that imagine my wife, she comes from the bedroom. She has a very nice sari. She has wonderful flowers, wonderful jewels. Now, what happens is that I get a burning sensation. Why? See, I am having a distress. See, I'm not satisfying my wife, so I'm having a distress, feeling sad. Yes. Now she seems to be happy. That means that I am not satisfying her, but she seems to be happy. It means that she's getting satisfaction from somebody else. That's how it starts. Then they will start tracking the WhatsApp messages. They will start following them wherever they go. They will just install hidden cameras, and by which they'll come as fully formed delusion. That is called as Othello syndrome. It's called as Othello syndrome. Second is called as De-Clermont syndrome. Let me see who's going to answer this. What is De-Clermont syndrome? What is De-Clermont syndrome? What is De-Clermont syndrome? What is De-Clermont syndrome? Wow, my God. Wonderful, wonderful. It's also called as delusion of Catatonia. Also called as psychosis passionate. Yes. Also called as delusion of wonderful, wonderful Jake. What is this? What is this? Wow. Yes. Sildenafil that we can prescribe of Othello syndrome. He's having erectile dysfunction. He's having psychosis. So you will treat the cause or you will treat the symptoms. What? So already the person is having sexual dysfunction, and this is leads to what is called as Othello syndrome. So for the delusion, you will treat the patient with antipsychotics, and you will choose an antipsychotic which does not hamper the sexual function. And even in spite of that, he's having erectile problems. Definitely, yes, we need to go for treatment of erectile dysfunction. It's a wonderful question, Dr. Sai Gaurav. Very happy. Very good. Now, what is this De-Clermont syndrome, also called as delusion of erotomania, also called as psychosis passionate, or delusion of love? Now, very importantly, what is this? Okay, see, this is very common where imagine that you are in a when I was doing my MBBS, when I went to psychiatry posting, there was as a professor. Okay, his name is Dr. Kumar. Okay, we used to call him Psycho Kumar. Okay, at that time I didn't know that I will take psychiatry, so I was happily calling him Psycho Kumar, Psycho Kumar. So Psycho Kumar once called me and told that Vivekanandan, take history from this patient. And it was a very young female. Okay, along I went and spoke with the female. I asked her, I introduced myself, ma'am. I am Vivekanandan. I'm a second year medical student. I'm here to take history. And I asked her, like, what is the reason that you have come to the psychiatric hospital? She told, mind your own business. Wow, that's a good start. That's why I developed some interest in psychiatry. Her mother was standing near her. I asked her, like, what is the problem, ma'am? Why have you brought her to the psychiatric hospital? She told that, sir, my daughter is in love, sir. That's why I have brought her for the treatment. I was like, what is wrong with you, ma'am? Why have you brought your daughter for being in love? Being in love is a wonderful thing. At that time, like in 2006 and all that, I had a delusion, false, fixed, firm belief that love is the best thing on earth. Now, after getting love marriage, I can confidently say that it's the worst thing on earth. But at that time, I was too young. Okay, Now I was saying that why did you bring her for treatment and all for being in love? Go and get her married to that boy itself. The mother asked me, sir, do you have brain? Shocked. Daughter is also scolding, mother is also scolding. She said that this girl is not loving some opposite house Kumar or neighborhood house Rajesh. This girl is loving Shah Rukh Khan. Okay. Then I thought, okay, she has been rightly brought to the hospital. Now, this Declaration syndrome or delusion of love, usually it's seen where a celebrity, okay, a superstar, okay, a celebrity or a very famous person they will initiate their love relationship with the female. It's more common females to the female. Okay. That is called as Declaration syndrome. It is called as Declaration. Yes, 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 friends. Yes, Sultanafil. Yes, as Sultanafil says that, see, when I love Aishwarya, loving Aishwarya is my birthright. Okay. I can confidently say that I love Aishwarya even in front of Aishwarya, even in front of Abhishek Bachchan. But if I say that Aishwarya is loving me, then it becomes a problem. Yes, Priyanka Chopra loving you is definitely a problem. Okay, you should come to me and get treated. Yes, yes, friends. Yes. Next we have something called as. Next we have something called as. Next we have something called as. What do you mean by egg bomb syndrome? Anybody can tell me what is egg bomb syndrome? What do you mean by egg bomb syndrome? What do you mean by egg bomb? What is egg bomb syndrome? Egg bomb syndrome is nothing but, please concentrate. Please concentrate. I want you to be very much attentive here. See, when a patient comes and says that, I can perception that there are insects crawling on my skin. What is it called as? What is it called as? Perception that there are insects crawling on my skin. When there is no insects, but I am perceiving something without the stimulus. What is it called as? Friends, keep on typing. Okay, it's how it helps keep it going. Yes. What is it called as? I'm perceiving something that there are insects crawling on my skin, but when I'm not able to see, when there is no stimulus, what is it called as? Perception without a stimulus is called as. Just now we are finished. What is it called as? Wonderful, Nehasha. Formigation or tactile hallucinations or cocaine. Yes, yes, yes. Is it clear? Is it clear? Clear. But if a person comes and says that, sir, I have a belief. What is a belief? It's found to be a false, fixed, firm belief that there are insects living inside my body. Living inside my body. There is a false, fixed, firm belief. Then you call it as delusional parasito, also called as delusional infestation. Delusional parasite is also called as. Yes, yes. Third to the query that Anuradha doctor is asking, I'm going to put it here. When a person is having restless leg syndrome, where a creepy, crawly feeling is there, we call that as Willis egg bomb disease. Okay. Circle of Willis. But as Willis. Anuradha doctor, this is mainly for you. Yes, friend. Yes. Yes. So a perception, when a person is having a perception and without a stimulus, you call it as fumigation or tactile hallucinations or cocaine bugs. But when as a belief that living insects inside my body, it is delusional parasites or delusional station. When கொடுத்துருங்க 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 ஓகே தேங்க்யூ. So what is this called as? What is this called as? Delusional parasitosis or delusional infestation. What is this restless leg syndrome? Restless leg syndrome is called as Willis eggworm disease. Yes. Now there is another question that they will commonly ask, which is called as delusion of doubles. Delusion of doubles. What do you mean by delusion of doubles? Delusion of doubles is nothing but or delusional misidentification syndrome, where we have two things called as Capgras syndrome and Frigoli syndrome. Capgras syndrome and Frigoli syndrome. What do you mean by Capgras syndrome? Anybody can tell me what is Capgras syndrome? Very important. You often asked Nick. What do you mean by Capgras syndrome? What is Capgras syndrome? What do you mean by Capgras syndrome? Capgras syndrome is nothing but it's a delusional misidentification. The definition of Capgras is familiar person is replaced by a non-familiar person. Okay, or it can be also called as familiar person is replaced by a or familiar person is replaced by a yeah. There are a lot of times students will come and ask me, sir, I have a doubt, sir. How will I not get confused between Capgras and Frico? I always tell friends, don't read both. When you read both, definitely will get confused. Read only one thing. Read only one thing. That is Capgras syndrome. Read only one thing. That is Capgras syndrome. Familiar person is replaced by a non-familiar person. What do you mean by that? It's nothing but, see, my mother is sitting in front of me. My mother is sitting in front of me. I look at her. I know that she's looking. I say that this woman is externally exactly looking like my mother, but this is not my mother. My mother is somewhere in Delhi. This is not my mother. This is my mother is being this as a speaker is nothing but a ghost. A familiar person is replaced by a non-familiar person. A familiar person is replaced by a ghost. A familiar person is replaced by imposter. It is called as Capgras. Read one thing by heart. Don't read two things. It will result in unwanted. Will be unwantedly will confuse things. So read only one thing. That is nothing but Capgras. Rigoli you will be able to answer. Yes. Yes, friends. Is it clear? Yes, friends. Is it clear? Yes. Yes. Madhusudan. Wow. Your type of person. Very good. Yes. Is it clear, friends? Is it clear? Yes. So this is very, 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 very important. Yes. Now we'll go to the discussion part. See whether we are able to answer the questions. Erotomania means what? Tell me the answer. Erotomania means what? Thank you. Thank you, Ajay, Achar, and JKN. What does it mean by erotomania? Erotomania means what? Erotomania. Very good. It's called as decarambol. Eggworm syndrome denotes what? Yes, exactly, Anuradha. It's like, for example, I'm seeing Anuradha for the first time. Okay, but I'm saying that Anuradha is my sister. Yeah, she is exactly looking is like my sister. Yeah, my sister has come in the form of I'm saying that she's Anuradha, but this is my sister. A non-familiar person is replaced by a familiar person. Yeah, so don't get confused. Just remember it as familiar person is replaced by non-familiar. Yes, yes. So egg-worm syndrome denotes what? Egg-worm syndrome denotes what? Worm syndrome denotes what? Worm syndrome. Delusional parasite. Delusional parasite. JKN has asked me a question. What is it called as matchbox sign? Yeah. Yeah, I'll come to that explanation here itself. I'll explain what is this matchbox sign. Matchbox sign is nothing but when people, usually this delusional parasitosis, okay, delusional infestation, people will come and say that, sir, there are insects living inside my body. I explained them, ma'am, it's not a hotel or it's not a lodge where insects can live in your body. There's no chance. Now, when you explain it to these old, usually it will be older people. When you explain it to them, they will be very much, they'll be defensive. They'll know how can you say that I'm the one who's is having that. They have a false fixed firm belief, right? Now, what happens is that after a week time, they will bring a small matchbox. That matchbox, they will have a small, tiny green like or a black like things. When I'll ask them, what is this, ma'am? What have you brought in this matchbox? They will say that, sir, last time I came and told you, you didn't believe me. Now, what happened was I saw the insects and I caught hold of the insects and I brought it to you. Now, this is called as matchbox sign. Now, what is this one? Basically, what happens is that they will be keep on scratching their skin. When I keep on scratching the skin for nearly 1 minute, what happens? Dirt will come. Yes. Now, this dirt, what they will believe is they have a false fixed family. They believe that it's a part of the body of the dead insect, and they will bring it. That is called as matchbox sign. It is called as matchbox sign. Yes. Yes. Yes, friends. Egg-worm syndrome is nothing but delusional parasitosis or delusional infestation. Okay. To differentiate between these three close related things, I have written 1, 2, 3 here. Please make it very clear. Somebody has asked me this. Vignesh, for you only, dear. Egg-worm syndrome is this. Yeah, egg-worm syndrome is nothing but delusional parasitosis or delusional infestation. Yeah, but at these two things, as it is closely related, I have mentioned here. Vignesh, you please give me a thumbs up if you are getting this. Dear Vignesh. Anuradha ji, pathological doubt is nothing but you doubt without any cause. Okay, that is called as pathological doubt. Psychosis, passionate is nothing but you are very passionate, you are or madly love with the person. So that is why it is called as psychosis, passionate. Yes, friends. Familiar person is replaced by non-familiar person is called as. Familiar person is replaced by non-familiar person is called as. Anybody can tell me? Familiar person is replaced by non-familiar person is called as. Familiar person is replaced by non called as. Very good. Just now we finished Capgras syndrome. Yes. Wonderful. We have finished the 6 questions in the first hour. Very good. Next, we are going to step into what is called as depression. Yes, depression. Can we go to depression, friends? Yes. Yes. What are all the things that you should know about depression? Finish depression and then we'll go. Okay. First and foremost, what are the things that you should know about depression? Is that what are the criterias of depression? Depression criteria is low mood. What is this low mood? Feel sad. Okay. Imagine that Anugraha, okay, Anuradha, I'm sorry. Anuradha calls me and tells that, sir, your teaching is very boring, sir. Please don't come for the class after break time, sir. I will kill you. She's scolding me very badly with nice vulgar words. Okay. How will I feel? I feel very sad, right? I feel very sad. Is it called depression? Is it called depression? Yes, tell me, Anuradha. If you scold me, I feel dull. Do you call it as depression? Do you call it as depression? Tell me. Madhusudan, you are scolding me in the middle of the class in front of everybody. If you're scolding me in the YouTube chat, I feel dull. I feel very sad. This is called depression. Tell me, Madhusudan. Is it called depression? No. Because even if you scold me, even if you give me very bad feedback, what happens is that I feel sad. I feel dull. But the moment I go and I start playing with my I have two kids. Okay, when I start playing with my kids, I will totally forget the whole world. Totally forget the whole world. Okay, so that is why I asked you this question deliberately. It's not at this low mood is not because the characteristic feature of the low mood should be pervasive, persistent. Wherever I go, wherever I go, okay, wherever I go in all spheres of life, I will have depression. This pervasive low. What is this persistent? Persistent means how long should I have the symptoms to call it as depression? What are the symptoms? How long should I have the symptoms to call it as depression? Anybody? Wonderful. Next criteria we have is anhedonia. What do you mean by anhedonia? Anybody can tell me what is anhedonia? What is anhedonia? Very good. Everybody is answering it very rightly. Tell me what is anhedonia. Sakshi, tell me what is anhedonia, dear doctor. Tell me what is anhedonia. What is anhedonia? Anhedonia is nothing but loss of interest in previous pleasurable activity. Previously, I used to like watching cricket. Now it is not giving me kick. Previously, I used to enjoy watching movies. Now it is not giving me kick. Wonderful, wonderful, JK. Along with it, along with it, they'll also have what is called as Beck's triad. What is Beck's triad? Anybody can tell me what is Beck's triad? What is Beck's triad? What is Beck's triad? It's a triad of Beck's triad. What is a Beck's triad? Anybody? What is Beck's triad? Wonderful, wonderful, Sipai. Very good. Negative view of oneself, negative view of others, negative view of future. If I ask you, tell me what is your what are you good at? What is your positive? What is your potentials? What will you all tell? What will you tell? What is the potentials? What is your good at? What is your positive? Can you tell me? Just tell what is your potentials? What are you good at? Yes. You'll be telling something, right? I'm good at public speaking. I'm good at dancing. I'm good at singing. But when you talk with a depressed person, what will he say? Sir, I don't have any talent, sir. What talent do I have, sir? I'm a fit for nothing fellow, sir. Negative view of oneself, which we call it as okay. Now, negative view of others. What do you mean by negative view of others? Negative view of others is nothing but why do depressed people are always alone? Because as they always as they feel that that I'm not fit. There nobody can help me out of this situation. I'm a helpless. Nobody can help me out of this situation. Called as what do you mean by negative view of future? Negative view of future. The most difficult, what is the most difficult job on earth? What is the most difficult job on earth? Most difficult job on earth is as applying for the NEET and applying and passing the NEET PG exam. Yes, yes, yes. When that is the most difficult job on earth, why are you all sitting and attending this TND batch and TND discussion and all that from evening 4 to 9 and for 2 days continuously for all subjects? Why? Because you have a hope. Okay, this person is blabbering something from which I'll get some questions, from which I'll be able to answer, from which it will help me to get the rank. Yes, that is called as hope. But when a person is having a negative view of future, okay, what will he have? He will have hopeless. Be hopeless. Now, as you are all having hope that you will definitely, you need to get a rank, you will get a rank, you are all preparing. But when you feel that when you're all hopeless, what will you do? Anuradha, what will you do if you feel that no way you're going to get the seat? Okay. What will you do, Shakshi, and what will you do, Madhusudan? And you know that confidently that you will not get seat at all. What will you do? Get married. Oh, your plans are all set. Plan A, plan B, plan C. What happens? When a person is hopeless, what will happen? A person is hopeless, he will end up in what is called as suicidal. Suicidal. Yes. The suicidal ideas is common in which gender? Which job? Tell me. Which gender the suicide ideas is very common? Very good. Males have increased suicidal. Yes. Suicidal. Very good. Whereas males have increased suicide or completed suicide. Yes. Yes, friends. What is the difference? What is the difference? Able to find the difference here. What is the difference? See, what is the difference is that at a female, female, what happens is that when she makes an idea that she should attempt a suicide, what does she do? She takes one on blunt blade. She texts a boyfriend at 7 o'clock. She doesn't get any reply by 7:1. Can wait only for 60 seconds. If by 7:1, if there is no reply, she'll think that okay, I'm going to die. She'll take a blunt blade. This blunt blade will not even sharpen a pencil. She'll take the blunt blade, she'll take the wrist, she'll bring the blade close to the wrist and then again take it away. Again close to the wrist, again take it away. Again close to the wrist and again take it away. Now she does this drama for nearly 40 minutes. Then finally she makes one small mark. Okay, that is called as one Swiss letter. But if a male decides that he has to die, what does he do? Okay, he makes a ground research. He makes a ground research, which is the tallest building in this locality. Okay, if you jump from second floor, ortho opinion, fracture. If you jump from the 11th floor, direct mortuary. Yes, so that's why males have increased suicide or completed suicide, whereas females have increased suicidias or suicidata. Which job has increased risk? Which job has increased? Farmers, because they are reliable on the low, they have a lot of loan sharks and they are reliable on the monsoon. Yes. And among doctors, can you tell me what are among the doctors who are at increased risk? Need PG preparation students, who are having increased. Yes. Anesthetist. Yes. Why anesthetists are increased risk? Why JK and anesthetists are at increased? Because what happens is that I had night shifts workers like IT. Yeah? Now, why are they at increased risk? Because anesthetist accessibility. Okay, see, when you are all dull or depressed, when I am dull or depressed, what will take? Will take one zolpidem or benzodiazepine. But when an anesthetist is dull or depressed, what happens? He will take one propofol and succinylcholine. So basically, it will make the person having an increased risk. Amit Dadlani, psychiatrists are not having increased risk. Okay, from 4 o'clock to 9 o'clock, I have literally pushed my two sons out of the house for doing this recording, and you're asking me to go and die. Amit Dadlani. What is this, Amit? Huh? So the more increased risk is with honest. Yes, yes. Now, who are the persons? Okay, when a person is having severe depression, with the suicidal ideas, what will be the treatment of choice? Anybody? What will be the treatment of choice? Person is having severe depression with suicidal ideas. What is the treatment of choice? Wonderful. Somebody has answered it very rightly. JKN, ECT. Can anybody tell me what is ECT? Electroconvulsive therapy. Electroconvulsive. Yes. Now there is a depression called as atypical depression. Can anybody tell me what is atypical depression? Can anybody tell me what is atypical depression? What is atypical depression? What is atypical depression? Very good, Achai. Achar. What is atypical depression? Atypical depression is a depression where there will be increased appetite, increased sleep. Yeah. They have leaden paralysis. Wonderful. Very good. It's not typical of depression. Okay. That's why it is called atypical depression. The treatment of choice is monoamine oxidase EA inhibitors. Next we have something called as winter depression. What is the treatment of choice for winter depression? Winter depression is a depression where it is common only in the winter season, where there is too much of snow. Okay, when there is too much of snow, in India you don't see too much of snow, but when you go to Russia or Canada where there is too much of snow, what happens is that then there's too much of snow, naturally the sunlight will be less. Because the sunlight being less, they will be more prone for depression. So here sunlight is less. So what is the treatment? Give sunlight. Are you Nityananda or what? To suddenly introduce sunlight. What will you give? Give light therapy. Light therapy plus antidepressants. Very good, Neha Shah. Plus counsel. Yes. Now there is a question that often they will ask. Okay. A person is having only depression. His lifetime is having only depression. What you will call it as? Only one pole. Call it as you are. The person is having only mania. Having only mania. What you will call it as? Only one pole. What you will call it as? Is called as bipolar. Why, sir? Why, sir? Because all manias, please concentrate, all manias start with a subsyndromal depression. Subsyndromal. Yes. When a person is having, please concentrate. When a person is having mania with the depression. Mania with the depression. Call it as bipolar 1. When a person has hypomania along with depression. Here it is full mania with depression. Hypomania is a lesser form of mania with depression. You call it as bipolar. And very importantly, a person between January to December is having 4 or more episodes in a year. What do you call it as? 4 or more episodes in a year. What do you call it as? Anybody? 4 or more episodes in a year. What do you call it as? 4 or more episodes in a year, what do you call it as? 4 or more episodes in a year, what do you call it as? Rhythmic bipolar. Wow, that's wonderful. Yes. Rapid cycling. Yes. When a person is having, he's not having full episode of depression. She's having a chronic low grade depression. Chronic low grade depression. Yeah. For more than 2 years. It's a very, 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 very stark question that has been asked in NEET and INSEE. A person is having chronic low grade depression for 3 years, 4 years, anything which is more than 2 years is called as chronic low grade depression for more than 2 years is called as. See who's going to answer this. Chronic low grade depression for 2 years is called as. It's called as. Yes, it's called as. It's called as. Wonderful, Nitin. This time. Wonderful one. It's very, very important. A person is having a chronic low grade depression for 2 years. Okay, he's having chronic low grade depression for 2 years. Yeah. Now having 2 weeks of full episode of depression. 2 weeks of full episode of depression. What is it called as? Here it is this time here, and here it is depression. What is it called as? The full JK. It's called as double depression. Double decker bus. Double depression. Very good, JK. Double depression. Double depression. Yes. Yes, friends. Is it clear? Yes. Clear, friends. Yes. Now, what is the neurotransmitter? What is a neurotransmitter that is most researched in the treatment or in the etiology of depression? What are the neurotransmitters? There are a number of neurotransmitters, but among the neurotransmitters, which is the neurotransmitter is most researched in the etiology of depression? Anybody can tell me? Wonderful, wonderful. Serotonin. Okay. If both serotonin and noradrenaline is there, you can go for both. Serotonin and noradrenaline. Yes, friends. Yes, yes. That's why in depression you will give what? SSRI. Selective serotonin reuptake inhibitors. Yes, friends. Yes, friends. Go for the see whether we have to answer the questions that has been asked. Okay. One thing that we have to discuss is called as the image based question that they will ask. Okay. Where a person depression have a frowning of their foreheads. What is this called as? We can tell me what it's called as. Mega sign. Yes, the upper eyelids. In the upper eyelids, will have a triangular fold. What is this called as? Varguvat. Whenever you read these two words, Varguvat fold and omega sign, means that you should know that it is C, you're dealing with one disorder that is called as Varguvat fold and omega sign is seen in. Yes. Yes. Omega sign and Varguvat fold is seen in. Yes, friends. Yes. Now I want you to concentrate. Let's go to the questions and we'll discuss things that you are able to answer it correctly. Varguvat fold is seen in. Not everybody to type the answer. Varguvat fold is seen in. Seen in. Key future of depression is. What is the key future of depression? There is low mood and also anhedonia. What will you give answer? What will you give the answer as? What is the key future of depression? Both low mood is also there, anhedonia is also there. Answer is actually, because this was a question which was, it's again a star question, which was asked in the FMG exam. Key future of depression is, okay. And you know, we have a WhatsApp group. Totally, there are some 8 to 9 psychiatry teachers all over India, yeah, for teaching this NEET and INICT and institutes. So for all the apps, and we discuss whenever there is a question paper, whenever there is an exam like INICT or FMG or NEET. And once in the FMG exam, was a question was in the recall session. We had one student who told that, sir, key future of depression was a question, sir. And we told that, okay, low mood should be the answer, very simple. He told that, no, sir, anhedonia was also there. Then we were very much concerned, because low mood is also characteristic feature of depression, then anhedonia is also characteristic feature of depression. But what happened was, in the one of the older textbook of a psychiatry, there is mentioned that the key feature of depression is pervasive persistent. The examiner has taken the question from that book. Okay, so if they ask you, they tend to repeat, okay, some sadistic pleasure they will get by asking such questions. That's okay. If they ask you the question again, what will you type? Everybody type low mood. Anhedonia is nothing but Nitin G. Loss of interest in previous pleasurable activities. Yes, it's very good. What is the duration criteria for depression? What is the duration criteria for depression? What is the duration criteria for depression? Very good, JK. 14 days. What is double depression? What is double depression? What is double depression? Double depression means what? Very good. I told you, know, they have a dysthymia, chronic low grade for more than 2 years. Along with it, one full episode of depression. It's called as double depression with the dysthymia. Yes. When a patient has recurrent depression and mania, their lifetime, the diagnosis is there is depression and also mania. So it is called as, what is the answer? There's recurrent depression, a comma here, and mania and the name. What do you call it as? Bipolar. What is the drug of choice for atypical depression? Atypical depression, what is the treatment of choice? For atypical depression, what is the treatment? No, may not. Phototherapy with counseling with antidepressants is used for what type of depression? Phototherapy, light therapy with the antidepressants. Hyperthymia is where hyperthymia is where a person will have chronic, they'll be having in their mood status will be like this. Imagine that this is a normal state. Hyperthymic will be like this. Whereas mania and depression will be like this. This is normal, this is hyperthymic, this is bipolar. Yes, is it clear? Maybe it's the wrong thing. It's very clear. It's nothing but bipolar disorder. Yes, friend. No problem. No problem. No problem. Yes, it's nothing but bipolar. Yes, friends. Don't worry, Divyaksh. Don't worry. It's just a mistake. No problem. The answer is very clear. Mania is also there. Depression is also there. Then you will call it as bipolar. Is it clear? Yes, friends? Yes. Give a thumbs up if you're okay with that. Neurotransmitter which is most researched to be associated with depression is. What is the neurotransmitter that is most researched? Serotonin and also noradrenaline. Serotonin, noradrenaline. Serotonin, noradrenaline. Yes. Cognitive triad is all except negative view of self, negative view of success, negative view of the world, negative future. Cognitive triad is all except. Cognitive triad is all except. Cognitive triad is all except. JKN. Negative view of the self, negative view of the others, and negative view of future. Most possible answer is the world is what they mean by others. So negative view of success doesn't. Yes, yes, friends. It's very good. Car chic. Now, there's a 15th very, very important question. Let me first ask you the answer. If you're able to answer it, then I'll explain a good amount of discussion on catatonia. Tell me, what do you mean by catatonia? All of the following is true about catatonia except there are symptoms that they mentioned: cataplexy, mutism, stupor, and echolalia. Anybody can tell me the answer of this? All of the following are symptoms of catatonia except. Very good. Answer is cataplexy. Let me explain discussion. Is answering correctly. What is catatonia? Catatonia will have symptoms of mutism. What is mutism? Mutism means what? Mutism means what? Mutism means what? They don't speak. Yes, no production of words. Stupor. Stupor means what? No awake and alert, but there is no motor response. They will have what is called as echolalia. Again, very important question. What is echolalia? Repetition of examiners have waxy, like a by flexing, like flexing a wax statue, they'll have waxy flexibility. Waxy flexibility. They will have what is called as cataplexy. I always tell make my friends to my students to say this in the class. Okay, please, 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 whenever, because they ask this question often, because to confuse you between, see, in catatonia you'll have catalepsy. What do you mean by catalepsy? Catalepsy is nothing but, and what is this? Abnormal posture against gravity. It's called as catalepsy. It's called as catalepsy. That is seen in catatonia. Yes. Now, what you should know is in narcolepsy, you will have cataplexy. What do you mean with it? A person will be there, is awake and alert. Suddenly, by an emotional stimuli, what happens? There is a loss of tone and he goes to sleep. So to confuse you between catalepsy and cataplexy, they'll be keep on asking this question again and again. Yeah, but you should be very sure to answer this. What is that? Please answer. Please answer. See, I always tell my students to repeat in the class. Okay, I want you to also do that. Whenever there's a question on catatonia, catalepsy, cataplexy, narcolepsy, I want you to all to just read one line. What is that line? Lepsy will not go with lepsy. Lepsy will not, repeat the line. Lepsy will not go with lepsy. Repeat the line. Lepsy will not go with lepsy. Repeat the line. Lepsy will not go with lepsy. Repeat the line. Repeat. Everybody, I want you to type. Repeat. Lepsy will not go with lepsy. Lepsy will not go with lepsy. Yes, repeat. Lepsy will not go with lepsy. Yes. Repeat, repeat, repeat. Lepsy will not go with lepsy. I want everybody to type here. Sir, it's very simple, sir. We know that, sir. I want everybody to type this. What is lepsy will not go with lepsy? What is it? Yes, thank you. Thank you, JK. Narcolepsy, you will have cataplexy, whereas in catatonia, you will have catalepsy. What is the treatment for catatonia? What is the treatment of choice for catatonia? Thank you, JK, and thank you, Ajay. Thank you, Divya Akash. What is the treatment of catatonia? When a person is having mutism, stupor, waxy flexibility, echolalia, in India, where they will take patient to? Patient will be taken to a Babaji. Yes, yes, Babaji. Yes. Now the Babaji will do some prayer and all that. Nothing will work. Then the patient will be taken to a church father. The church father will do some prayer. Nothing will work. Then the patient will be taken to a Ayurveda doctor. Then the Ayurveda doctor will do some magic. Nothing will work. Then the patient will be taken to you, general practitioner. You, general practitioner, doesn't know to treat common cold, but you'll be treating catatonia. Yes. After some 2 weeks, okay, the patient is brought to the psychiatric hospital. It will be written here. My diagnosis is catatonia. Okay. As soon as the doctor sees the patient with these catatonic symptoms, what he'll do? He'll give you one injection. With that one injection, the patient will start talking, start walking. Okay, the mutism, stupor, waxy flexibility, everything will improve. What is the team? Miraculous drug. Lorazepam. Okay, the whole family will come and fall in our legs. On the psychiatrist's legs. Sir, you're like God, sir. We'll say, please don't fall in our legs. But internally, we'll be very happy. Nicely fall in my legs. Why did you come late? Now, what is that injection? Lorazepam. That's why I want you to concentrate. It's called as magical response to lorazepam or lorazepam challenge test. They don't improve with lorazepam, then only will go for what is called as ECT. Already I've told you somewhere about ECT. Where? Severe depression with suicidal ideas, the treatment of choice would be ECT. Here the treatment of choice would be lorazepam. If that doesn't have a choice, then you go for ECT. Here it's again a star question where they told that a person coming with mutism, stupor, waxy flexibility, what is the treatment of choice? You will go for lorazepam. You will go for lorazepam. Yes, yes. Is it clear, friends? Is it clear, friends? Now I'm going to go for a rapid revision for 7 minutes. I want everybody to come to the Telegram and YouTube chat. Yes. Tell me what is misinterpretation of stimulus. Start. Tell me what is misinterpretation of stimulus. Everybody. Please make some noise. IV. We give it as IV for faster response, dear. Tell me what is misinterpretation of stimulus. Very good, JKN. Wonderful, JKN. Illusion. Very good. What is perception without a stimulus? What is perception without a stimulus? What is perception without a stimulus? Please type. What is perception without a stimulus? Very good, JKN. Hallucination. Very good. What is called as most common cause for auditory hallucinations? What is the most common cause for auditory hallucination? Most common cause for auditory hallucination. Wonderful. Amit. Schizophrenia. What is the most common cause for visual hallucination? The Instagram question I have clearly mentioned which of the following symptoms suggest for visual hallucination, organic disorder except. Okay, if anybody is in my Instagram page, you should have known by this today morning only I framed that question. So what is that visual hallucination is seen in? Visual hallucination is seen in anybody? Yes. Yes. Specific, very good. Organic, neurological, and among the psychiatric disorders, we have something called as delirium tremens, also called as senin alcohol withdrawal. Tactile hallucination. What are the other names for tactile hallucinations? What are the other names for tactile hallucinations? What are the other names for tactile hallucinations? What is the other name for tactile hallucinations? Cocaine bugs, wonderful. Fumigation, wonderful. Magnan syndrome, wonderful. Sapai, Dadlani, KKM. Very. What is the delusion of persecution reference is seen in? Persecution of reference and seen in. Persecution reference is seen in. Delusion of persecution reference is seen in. Schizophrenia. Very good. Very good. Amit. Delusion of nihilism is seen in. NICT question. Delusion of nihilism is seen in. Delusion of nihilism is seen in. Wonderful, JK. Depression with psychosis. Grandiose delusions is seen in. Grandiose delusions is seen in. Very good. Very good. Please keep it going. Grandiose delusions is seen in. Wonderful. Wonderful. Nitin. Grandiose delusions is seen in. Grandiose delusions. Mania with psychosis. Very good. Amit Adlani. Uh, what is the Othello syndrome is common in what substance? Othello syndrome is common in what substance? Othello syndrome is common in what substance? Wonderful. Alcohol. Very good, JKN. Delusion of love or erotomania or psychosis passionate is called as what syndrome? Delusion of love or erotomania or psychosis passionate is called as what syndrome? It's called as what syndrome? Very good, JKN. Dash is replaced by dash in dash syndrome. Dash is replaced by dash in dash syndrome. I told you to read only one thing. Okay. Dash is replaced by dash in dash syndrome. See who's going to type this. Dash is replaced by dash in dash syndrome. Dash is replaced by dash in dash syndrome. Dash is replaced by dash in dash syndrome. Wonderful. Familiar person is replaced by unfamiliar person, or familiar person is replaced by ghost, or familiar person is replaced by Capgras syndrome. Dash and dash is called as delusion of doubles. Dash and dash is called delusion of doubles. Dash and dash is called delusion of doubles. Dash and dash is called delusion of doubles. So you have two syndromes, Capgras and frequent. Very good, Amit Datlani. I want you to type what is the difference between tactile hallucinations, formation of cocaine bugs, and Ekbom syndrome and Willis Ekbom disease. Three things I have discussed. Can anybody tell me what is the difference between the three? Yes. Right, right. Pretty. Yes. 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 Just right. With Ajay for our typing is going to first answer. Amit. That. Yeah, very good. Then egg bombs is insects living inside the body. Fumigation is insects crawling on the skin. Wonderful, Amit. And very importantly, Willis Egg-borne disease is restless leg syndrome. Wonderful, Amit. Yes, I think things are very clear. Yes, yes, friends. So time is 5:40. Please take a break for 15 to 20 minutes. Yes, 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 wonderful. Ajay Kachkar, you can say that it's perception and this is belief. That would be more apt. Very good, Ajay Kachkar. So we'll take a break of 15 minutes to 20 minutes and then we'll be back by 6 and we'll have a quick recap of other small topics and then we'll go to the questions and discussions. Yes, give a thumbs up if you're all fine. Give a thumbs up. Give a thumbs up, friends. Amit, give a thumbs up. Give a thumbs up. Wonderful, wonderful, Anuradha. Give a thumbs up. Wonderful. Thank you.